Hi, Dr. Anita Haque, your chiropractic coach and mentor to help you achieve unbelievable levels of success in your own career. So today I want to talk to you a little bit about patients who might be getting sick, who have a cold, a sinus issue, and it causes them headaches, head pressure, sinus pressure. So here's my protocol to work on getting that improved. Obviously, we already know through schooling in neurology that the C1 vertebrae houses the nerve that really affects the immune system, which is why I'm actually going to start my patient here face up and really focus on that C1 area. So I'm going to walk you through my protocol, and maybe it can help some of your patients who suffer with colds, flu, sinus issues, and headaches all kind of lumped together. So first and foremost, what I'm going to do with this patient is I'm going to check her C1, and it's definitely subluxated, meaning it's out of place here on this right side. She can feel it. And so I'm going to get right in. I usually do a thumb push, and I'm going to get her to relax. In my previous video, I kind of explained some of my secret tips to help your patient relax. I did one of my little tips right now, which is just sort of distracting her shoulder a little bit, and it really allowed us to get a good range of motion, good adjustment in there. How's that feel? You okay? Mm-hmm. So once that's done, so the right C1 is what I adjusted. Now I'm going to kind of work on the left occipital ridge, which is another big region for, the immune system, getting her head to be released. It's also great for like migraine sufferers to really just get them to lay face up and work on that C1 and the occipital ridge. Great. I also, with that adjustment, got her C2, and we want to make sure anytime someone's suffering with a cold, we want to get those nasal passages to open up. So I'm going to make sure we get that C2. There's one more spot that's going to help your nasal area. So we're going to get C2 and C3. So I'm going to just let her shoulder relax again. And there we go. Rechecking. She knows I'm rechecking. She can tell that I know the difference, that things are aligned better. And then once that's done, this is part 2 to making sure we really get that relief in for the patient. So lift up your head. I always work on my patient's posture, so that's why I'm using the neck orthotic here on her. And then I'm going to get in on the cranial sutures of her skull and just put my fingers in there, and I'm going to help to release it. That's the tissue between there gets so tight, especially for someone who's suffering with migraines, headaches, sinus pressure. It kind of goes in here. So I like to slide my fingers, put a little bit of like pressure in there, and then as soon as I feel it release, I release my hands, and I try to just kind of get rid of some of that energy out of there so I don't keep it in my own body. So you want to make sure you're careful of that as well. So we're just going to do a little bit more. And then the next thing to help her is I take my thumbs and I go over the ridge here where the eyebrows are. And in doing that, I'm sliding my thumbs all the way through because a lot of sinus pressure and buildup can be in here. So I'm pushing it through so we can help to move some of that stuck fluid that starts to get a little bit too sticky in there. And then we're going to go to this sinus cavity here. This is a very powerful one to also put your fingers on and just move it all the way through. So just pushing your thumbs, you're going to move it through. There you go. And then I go back. Take a deep breath in from your nose if you can. Good. And out. Excellent. And then just check on the patient. And it's really as simple as that. I don't usually adjust the rest of the spine when someone's coming down with a cold or if they're suffering with a migraine or headache. We just focus on the occipital ridge, C1, C2, C3. I hope this was helpful for you and your patients. I'll be back again soon with another tip.